Welcome back. Surgeons are feared to becoming redundant and obsolete in the advent of new technology that is seemingly replacing them. In the studio to squash that myth and show that technology cannot work without the human apparatus it is replacing is Mr. Edwin Muguti. He's the former Deputy Minister of Health and Child Welfare, and he's also a specialist consultant surgeon. Welcome to Good Morning Zimbabwe.
Thank you very much for inviting me.
Is it possible, in the light of technological advancements worldwide and particularly in the country, that professional doctors and surgeons in general can be replaced by equipment?
No, I don't think it's possible for any machinery or any tool to replace the human being. What this modern technology does is to enhance the capacity of the doctor to deliver better quality medical care to their patients. So these are innovations that have occurred over many years, which have improved the quality of the surgeon's work. So I can give a few examples. In the past, there are situations where one would have to do an exploratory operation. In other words, to open the human body, to look inside and see what the problem is and deal with it. With technology now, you are able to actually visualize the inside of the human body without opening, so that by the time you do the surgery that is necessary, you already have a clear image of what you are going to be dealing with. So it's very good for planning. So there's very little guesswork now. Most of the work can be done in a focused manner, which is directed at the seat of disease, instead of making huge cuts, which can actually be quite debilitating to the patient. So technology enhances the work of the surgeon. So we work very, very much with technology. Lately in Zimbabwe, we've ordered new laparoscopic equipment, minimal access equipment, whereby instead of opening the body, we will put a camera inside, and we put small instruments which are controlled from outside, guided by a television screen. So instead of having a big cut like that, you have three little holes, and that's it. The same can be done in the head, the chest, in the abdomen, everywhere. You can even operate on the human fetus in the uterus. We are not doing that here yet, but in other countries they're doing that. If a disease is detected in the fetus before the baby is born, they say operation can be done inside the uterus and the baby can be born without disease. I could go on and on, but the key point is that technology enhances the quality of our work.
It cannot replace the human.
It cannot. Yes.
Okay, so tell us about the magnetic resonance imaging MRI unit.
Yeah, this is an imaging technique similar to CT scan. The whole idea is, over the years, scientists have always wanted to be able to visualize the inside of the body without opening it. So MRI utilizes magnetic energy to look inside the human body. So when you go through an MRI scanner, you can actually see images of your brain, right down to a minute detail. You can see the brain, you can see blood vessels, you can see different parts of the body just by looking at the screen without opening the patient. It's similar to CT scan, except that with CT scan you use radiation, whereas with magnetic resonance imaging you do not use any radiation. It's a magnetism, so it's safer for the patient. But it allows you to see body organs in detail, and also with computer technology you can do three-dimensional reconstruction of the body organ, including the diseased part, so that by the time you do your operation, you already know where to cut and where not to cut and where the vital organs are. So it makes the surgeon's job much easier and much safer.
Okay. Yes. And you just talked about radiation. I was about to ask about the risks to the people who will be, yes, you were I was just about to ask about the risks, where we had the CT scans. So the MRI does not use radiation, it all has to do with magnetic resonance.
Yes.
Okay, well, thank you very much for joining us on Good Morning Zimbabwe.
You're welcome. Thank you very much.
That was the former Deputy Minister of Health and Child Welfare, who is also a specialist consultant surgeon, Mr. Edwin Muguti. And he was here to encourage both government and private stakeholders to engage in medical technology innovations if the medical fraternity is to maintain its second to none status. This is the second hour of Good Morning Zimbabwe. We'll take another short break. Stay with us.